So it's my pleasure now to introduce Dr. Daniel Corcos, who is a professor of physical therapy and human movement science at Northwestern University. He's a motor system neuroscientist working on human electrophysiology using TMS, fMRI, EEG, and EMG, as well as neuronal recordings in patients undergoing brain surgery. The primary goal of his research is to understand the mechanisms underlying therapeutic interventions for people with Parkinson's disease. One line of research studies how progressive resistant exercise improves the motor and non-motor systems of people with Parkinson's disease. A second line of research focuses on endurance exercise. The third line of research focuses on how deep brain stimulation of the globus pallidus and the subthalamic nucleus affects the motor and non-motor symptoms of people with Parkinson's disease. You know that we have discovered over the years the importance of physical therapy. We had a discussion last night about the fact that in the past people dismissed physical therapy as possibly useful as an adjunct, and we now realize that it's an important mainstay in the treatment of Parkinson's disease. I'd like to thank Dr. Corcos for coming here from Chicago to discuss this important issue.
I would very much like to thank Mary Sue Lanigan for inviting me, and also the Michigan Parkinson Foundation. I think they do a truly marvelous job of trying to help people who have this disease. I was very impressed with the three opening speeches, lectures. Had I realized how good they were, I probably would have declined the option to talk. So, if you ever want a little bit of inspiration, Google Jimmy Choi. Have any of you heard of Jimmy Choi? Yes. Well, I put his slide up there. This is Jimmy Choi. He has young onset Parkinson's disease, and he does Ninja Warrior. And you go and watch his 5-minute video, and you just are impressed. Okay, it really shows what one can do. He's an amazing person. Not everybody can do that, I understand that. But most of us can walk. The other gentleman there, Bill Bucklew, has Parkinson's disease, just finished walking 2,503 miles across most of America and ended up in California. They have the disease. I had lunch with them last week, and they are true passionate advocates for exercise to help. What I hope to do today is, first of all, to stress to all of you, whether you have a disease or not, the importance of overall activity. The evidence is quite strong that some people with Parkinson's disease end up with reduced overall levels of activity, and that ultimately is not good. Now, most people don't like weight training, progressive resistance exercise, but it is terrifically beneficial for you. It is recommended by the CDC, it's recommended by the American College of Sports Medicine, it's recommended by NIH. And I'm going to show you that it is therapeutically beneficial, and you should think about it. I'm then going to show you that endurance exercise is therapeutically beneficial, and we're getting a hint that it might slow disease progression. And as we've heard in our three presentations, at some point, balance is affected in Parkinson's disease. And so one has to do activities specifically for balance. Many of my colleagues have this as their screensaver. Now, exercise is not a cure, but it is a tremendously effective treatment. And I would bet a lot of money if one could put into a pill all the benefits of exercise. You would all be taking that pill however often you were told to take it. Unfortunately, and I recognize this, not everybody relates. fact, some people don't even like the exercise word. And if you don't, that's fine. Then use a term like activity or anything which engages you. Because, and we've known this also for a long while, Oscar Wilde is not alone when he said, to get back my youth, I would do anything in the world except take exercise, get up early, or be respectable. And so we know that it's a problem, but what I hope to do today is to show you that the evidence is so incontrovertible that if you have the Oscar Wilde leaning, you find a way to overcome it. So this is written about in many ways, and this is the vicious circle of Parkinson's disease. So you've heard 3 terrific presentations outlining the problems with the motor features and the non-motor features. And it's very easy to see how this will feed into a sedentary lifestyle. This arrow up here is really quite important because everybody is after something neuroprotective, whether it's exercise or pharma. But it may turn out that, in fact, lack of exercise is non-protective, and that's what this arrow is to show. And so the idea here is to kind of urge you to keep on moving, because if you don't, you go down this path, which is the path we're all trying to avoid. Now, we're all motivated by different things. My wife, absolutely addicted to 10,000 steps. Other forms of activity, I mean, she does occasionally, but she loves her monitor, she loves her 10,000 steps, and if that's what works for you, it is terrific. I would caution you because another friend of mine had a wonderful Fitbit that she left lying around. And this is what happened. And this is what happened to the Fitbit. So, take care of the Fitbit. Now, we know it's just exercise, and we've known since the days of Plato and Aristotle. And Plato said, lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it. We've known it for a long time, but now what we're starting to build is a very robust evidence set that shows how good it is and what are the best types of exercise. So why study progressive resistance exercise? Now, one of the things I love doing is teaching graduates, and that's graduates in the Doctor of Physical Therapy program. Gave the lecture the other day, and I asked them, how many of you do progressive resistance exercise? And about a third of the hands go up. Let me ask here, how many of you do some form of resistance training? Well, this is impressive, this is good. Well, for those of you who don't, if it's good enough for the squirrel, why is it not good enough for you? So for those of you who don't do resistance exercise, just put a little note against the next slide. And I want you to focus up here, okay? Now this is for people who are over 60, and what we have here is all-cause mortality, and it shows the probability of mortality. And if you're in the lower third of strength, you have a higher probability of dying earlier than if you are in the top third. You can think of this a much simpler way, okay? You look at people who are frail. 1 of 5 criteria of frailty is weakness. So weakness is not good. So in this plot, we have age going from 20 to 100, and here we have maximal voluntary contraction. It's a fancy way of asking, how strong are you? And this slide is very important for several reasons. So, we have in here some of you who are, very young, perhaps in your 20s and 30s. When I give this lecture to my students, I routinely point out that I'm here. And what you see is that we're going across, up until maybe 60, strength is pretty good. But I want you to notice 2 things, what happens here. For some, there is this precipitous decline. And for others, they're doing pretty well. So Northwestern, for example, has a program dedicated to what are called super agers, people in their 80s, who are still doing very, very well. They look no different to people in their 50s. And so looking after yourself is important. So I'm going to walk you through a study that I published first in 2013, there have been many subsequent follow-ups, and I compared progressive resistance exercise to Fitness Counts. Fitness Counts is a very good booklet. It's put out by a physical therapist, and it gives you a lot of different exercises to do. But it is not systematically progressive in the way that if you do a weight training program can be. I did this over 24 months because, as the previous speaker pointed out, and the other speakers, you've got to continue to do this. I wanted to show that people with the disease will stick with it for 2 years. Because my view is if you can do it for 2 years, why not just keep on doing it? We test people in the practically defined off, which can be disputed, because that allows us to see the Parkinson's disease most clearly expressed. So patients were randomized to progressive resistance exercise or Fitness Counts. The government, you the taxpayer, paid for a personal trainer at the local gym, and the trainer was instructed how to administer the program and informed the patient group assignment. Neither personal trainer nor patient was made aware of the hypothesis we were trying to test. Individuals worked out twice a week, 90 minutes per session. We asked them to do no other form of exercise. That's just because this was a research project. For you, you should do other forms of exercise as well. For 7 to 24 months, it was a personal trainer once a week, and they worked alone. I'm going to walk you through 11 strengthening exercises. So here is the Fitness Counts book. It was published in 2006. It is stretches, non-progressive strengthening, breathing, and balance. It's the same at every session. So these are the 11 exercises, and the goal here was to make people, or it would be to make you unabashedly stronger. We have a chest press, a reverse fly, a latissimus dorsi pull down, double leg press, hip extension, biceps curl, shoulder press, rotary cuff, triceps extension, back extension, and seated quad. And so individuals with Parkinson's disease did this for 2 years. The outcome measure was the Unified Parkinson's Disease Rating Scale, and it was obtained at baseline 6, 12, 18, and 24 months. So I'm now going to show you some unabashed PR. You can take it or leave it for what it is. I will follow up with some actual data.
In Chicago is finding the effects of Parkinson's disease can be minimized without medication.
CBS 2's Vince Gerasoli has a look at the research that stands to change the lives of those with the disorder.
Keep your chest lifted, keep breathing.
His workouts with the trainer are about much more than getting in shape.
Squeeze. Excellent.
David Bervelier has Parkinson's disease. Moving his muscles has been a challenge for decades.
I suddenly found that for large portions of the day, I couldn't move. And for about a week, I was just scared.
Whoa, slow it down, slow it down, slow it down.
After 2 years of these sessions, David is obviously feeling different, both physically and mentally.
I believe that I can virtually credit my survival to it.
And pull, 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 pull. Good job, good, go, 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 go.
Bervelier gets a second workout of sorts as part of a study at Rush University Medical Center and the University of Illinois in Chicago. Here, researchers are gauging the impact of stretching and weight training on the muscle control of Parkinson's patients when they aren't taking medication. Initial results are promising.
We're finding people when they came in couldn't even stand on one leg for 1 second, and 6 months after the exercise program are standing on a leg 20 seconds, 30 seconds, 40 seconds, some people up to a minute.
Look here, while a healthy patient could push this bar with one smooth muscle movement, Parkinson's patients require a series of muscle bursts.
You can see you've got multiple bursts. You got 1, 2, 3, 4.
So for a healthy person, there'd be one complete burst, and in a Parkinson's patient here, you see multiple bursts.
Correct.
But check out the change in the graph after just 6 months of training.
In this case, they only have 1, 2 bursts prior to peak velocity.
That's a dramatic difference, isn't it?
Oh, it's a substantial difference.
This is new. I think your average neurologist, when they take care of a Parkinson patient, doesn't mention exercise. They mention drugs.
Nice.
They don't mention exercise.
Physicians in the study say these first results indicate exercise can partially liberate patients from the drowsiness and motor complications that can be side effects of Parkinson's medication.
Can I ask how old you are?
66.
David knows he will never be medication-free, but he sure likes the changes in his life.
The differences between living like I'm 85 or 90 years old all the time, or having a lot of times where I feel I can get up like I'm 30 or so years old.
48 patients are taking part in this study, working out at least twice a week. Doctors say their muscle movements will never return to normal, but all are showing some signs of improvement.
And Vince tells us the patients are placed in two groups, one that only does stretching and one that only does weight training. The complete study will be done in about 2 years.
So I presented my video in England, and as some of you may know, the English can be occasionally a little dry. My colleague, a very distinguished neurophysiologist, explained to me, Daniel, all as you've shown me is that when you take a very, very nice older person with a very, very nice younger person, the nice older person feels good and does better. So, let me give you the data. We've reached a point when it is probably, if not certainly, unethical to assign people to a control group where they do, or they're asked not to exercise for an extended period of time. We know how good it is that if you were assigned to a control group to do nothing, that would not be ethical. The reasons for doing it scientifically are compelling, and so one has to try to get around this. Well, one way you can, in a loose way, get around it is you look at the literature and you ask yourself the question, how much does this disease, on average, progress per year? And that's what this green dot is. So the Motor Unified Parkinson's Disease Rating Scale, on average, a person will progress about 3 points a year. Some people less, some people more. So after 2 years, a person would be 6 points worse. If you look here at the fitness counts, after 6 months, they did much better. And you will find that for any disease you look at, something against nothing works pretty well, because people, by and large, are so deconditioned. But then over time, the fitness counts returns, and this is the mean change from baseline in the UPDRS. So they're still 6 points better off than if they had not done the weight training. But the group who did the weight training are now 13 points better off than had they done nothing, and they're about 6 points better off than the group who did fitness counts. And what people have taken a lot of trouble to do is to define terms like the minimally clinically important difference. So just because one shows a difference which is statistically significant, this may not matter to a person who has the disease or is treating the disease. What a change of 5, 6, 7 points on the Unified Parkinson's Disease Rating Scale is clinically important. This slide is showing how much stronger they got in their flexor muscles, so they were generating 10 Newton meters more of torque. This is showing how much stronger they were in their extensor muscles. So they're getting much stronger. This is a study from a colleague of mine at the University of Alabama, Birmingham, not the real Birmingham, because the real Birmingham's just around the corner, but there's this other kind of not so real Birmingham a little way away. And what I want you to note is for leg strength. So this is a match control, this is a mean, this is a measure of how variable people are in general. So people with Parkinson's disease are weaker in their leg muscles. But if you go back and if you ever watch this video of Jimmy Choi, okay, there is nothing about the disease which means that this is completely inevitable. So after 16 weeks of very serious weight training, the individuals are now much stronger than a typical matched control group. So it's doable. Now, why am I so passionate about weight training? And I am. Well, you know, some people like big biceps, others like tuned triceps, others doing it for the body. But that's not where I think the real importance is. I think the real importance is that the evidence accumulates that by working the muscles, you facilitate the brain. And so this is a slide. You can find the article, or I can have it sent. It's published in Movement Disorders in 2015. It was voted Paper of the Year in Movement Disorders because what it shows you is you take a measure of cognition, for example, digispan, which is basically how well you can remember. And after 24 months, okay, this is the average of the fitness counts group and the resistance group, there was actually no difference between the groups. But both groups had improved digispan sum score, and this is a control group. It wasn't a real control group. We followed people in Florida for 12 months on the same test. Over time, your digispan will stay the same or go down. And so to do weight training to look better, that's not going to motivate many. Trust me, for those of you who go to certain kinds of gym, there are people who do it for that reason and that reason only. But I want to push this quite hard because the evidence is strong that it's good for your brain. And I'm going to follow up with another form of resistance training. So for those of you who are therapists, you're very well aware that one can use all kinds of instability devices to help in rehabilitation. And this works very well for proprioception. And I worked with colleagues in Brazil, and they did an amazing study. So imagine that you're doing a leg press, and you have a device here which is making you unstable, and a device here which is making you unstable. And so they do these 5 big whole body exercises. And as an aside note here, I was pointing out earlier in the presentations that just because you have Parkinson's disease does not make you immune from every other ailment. And so for those of you who have arthritis and various other ailments, you can actually work out with half the amount of weights, but when you're in terms of the load moved, but you get just as strong when you do it in an instability environment. And so that is putting much less stress on the joints. So if you look here, this is the motor UPDRS. The control group got, there's no statistical difference, got a little bit higher number here. The resistance training group is very similar. But in 12 weeks, they improved the UPDRS. It took me much longer than that. Now, this is the most amazing slide. So this is the Montreal Cognitive Assessment. And if you are scored 25 or lower, you have probable mild cognitive impairment, which is quite prevalent as Parkinson's disease progresses. And so if you look here, these people are all 25 and less. They go in the weight training program, and all these people now have a MoCA score above the level of mild cognitive impairment. So if you think that mild cognitive impairment is something that could be coming to you down the line, I certainly think I've got a possibility of it coming to me, so I certainly look at this data myself. I would think seriously about what the squirrel was doing, weight training. So working out with weights twice a week is very therapeutically beneficial, and I would encourage all of you, whether you have a disease or not, to think about it. I don't want to get you confused. A lot of people use the word aerobic exercise. I simply use the word endurance exercise because when you do exercise, you can sometimes use an aerobic metabolism and you can sometimes use an anaerobic metabolism, and you're not quite sure which one is which. Endurance is a much more encompassing term. So I'm going to show you another video.
Or to put it the other way around, would more exercise mean less Parkinson's? The answer to that question may come from a surprising source.
We're probably the only lab in the world that runs monkeys on treadmills, so it is not an everyday occurrence.
To test the impact of exercise on Parkinson's, the University of Pittsburgh's Dr. Judy Cameron has divided monkeys into 2 groups, the runners and the watchers. The running monkeys trained for 3 months. The watchers, well, they just watch. And then both groups are injected with the toxin MPTP, the same toxic substance that caused instant Parkinson's in the frozen addicts.
What we're seeing is monkeys that have run on the treadmill have very little effect of the MPTP. And they're still able to use the side in which they received the injection, and they can use it very normally. The monkeys that are running look very different from the sedentary controls. The sedentary controls aren't really using their arm. They're letting their arm hang down. It makes us think that exercise somehow changes how the brain is functioning and protects it against damage.
Everybody ready?
Ready.
To see exactly what's going on, the animals are then given a brain scan. The results prove to be dramatic.
It's a pretty massive lesion.
The MPTP injection has decimated dopamine production in the monkeys who watched but didn't run.
But in contrast, the running animal,
The lesion is much less.
in fact, in some of these slices, you'd be hard-pressed to know that there was a lesion at all.
Right, so.
In fact, while the MPTP knocked out dopamine production on one side of the brain in the sedentary monkeys, the running monkeys were only minimally affected. Their dopamine production remained virtually normal.
So what we're finding is that when we exercise the monkeys on the treadmill, for the amount of exercise that clinicians would recommend that middle-aged people undertake, their brain is less likely to be damaged when there's an insult.
And that's the key question. Is what's good for the monkey good for you?
Well, the answer to the question is that what was good for the squirrel and what was good for the monkey is most definitely good for you. So the rationale, these are just some big words, but I just want you to get a sense of how all-encompassing endurance exercise is across the body. So we've heard lots and lots about dopamine metabolism, and so anything we can do to raise endogenously, that means from within as opposed to from medication, is good. This is very good for heart and blood vessels. Remember, they deliver oxygen, and they deliver oxygen to the brain, and that is very good. There's a teeny bit of evidence that there is neurogenesis in one particular part of the brain, so neurons may be regenerating. Increasing your ability to use oxygen is good. So if you're walking around the mall with a grandchild, etc., and your VO2 max is very low, you're going to get out of breath and you're going to struggle to keep up. Endurance exercise increases. There's evidence that it improves the economy of walking. So the more economical your walking is, the easier it is, and the further you can go. Everybody's interested in neuroplasticity, so the idea here is that we can change the brain. There is very compelling evidence that the brain is not just static. We can do a lot to organize and reorganize brain networks. We heard in earlier presentations about inflammation. Exercise can help reduce inflammation. It improves mitochondrial function and oxidative stress. It improves the connectivity between different brain regions which talk to each other. And it increases levels of neurotrophic factors, such as brain-derived neurotrophic factor. So these are all very good for all of us. This slide is very hard to read, and you don't have to worry about it. All you need to know is at the bottom, there were 43 people assigned to do high-intensity endurance exercise. 43 people completed, and we had 45 complete doing moderate intensity, and here we did have a usual care group for 6 months. We decided it was okay to let people have usual care, so if they were exercising, we didn't stop them, and then after 6 months, they were randomly assigned to one of two treatment arms, either high intensity at 80 to 85% maximal heart rate, or moderate intensity at 60 to 65% heart rate. And this was an NIH-funded phase 2 clinical trial, and we're trying to answer the question, is there a dose response to exercise? So we know that many people don't like getting their heart rate really high, And if there's no evidence that it's helpful, then why should one do it? Okay? But if there is scientific evidence that it's helpful, then each of us has a question to ask and answer for ourselves: is it worth doing? And what has happened in many studies over the last 30 years is big phase 3 clinical trials which are designed to change clinical practice. They don't work because they haven't done enough preparatory work to make sure that everything is in place. It's really hard to do a multi-site big study. So we did a small study across 3 sites at Colorado, Pittsburgh, and in Chicago. And the first question we wanted to know is can and will people who have Parkinson's disease, can they hold their maximum heart rate at 80 to 85%? And if you look across here, we give people 8 weeks to get used to the conditioning. The previous speaker pointed out very, very well that you don't want to jump into this too quickly, okay? So we give people 8 weeks, and after 8 weeks, from week 9 to 26, we measure their heart rate. And so this shows that people with Parkinson's disease can work out with their heart rate between 80 and 85%. This is the group who were assigned 60 to 65%, and you can see they got a little bit enthusiastic. And so their heart rate was closer to 66, 67. The one thing we found out for certain in this study is the people in the study, our feedback was universally positive. So another thing we weren't sure is, could people do this 4 days a week? Because for the dose, you need the heart rate, you need the duration, this was 30 minutes, and we originally wanted 4 days a week. And so here is our 4-day-a-week target, and you'll see the 60 to 65% was a little higher than the 80 to 85%. This was not statistically significant. And so for those of you who are physicians, those of you who are therapists, the take-home message here is, if you want 3 days a week, prescribe 4. And I'll tell you why this is, okay? So look, if you're a grandparent and one of your children says, I just need help with my child today, what are you going to do? You're going to help. You're not going to do your exercise program. You may be ill, you've got Christmas, you've got Thanksgiving, you've got Hanukkah, you've got any one of a number of different religious holidays. And so for all of us, it's very hard to keep our exercise routine going vigorously and rigorously consistently. But this is why we did the study, because we now know that if we want 3 days a week as our dose, then we're going to prescribe 4, and we're going to get somewhere between 3 and 4. So these are the results. So what this bar here shows, this is the 6-month change in the UPDRS motor score. And after 6 months, there was a change of 0.3. Not very much. So the motor score hadn't changed very much. For the group who were the 60 to 65%, it had moved more. The disease had progressed more. And for the usual care group, the disease had progressed even more. So if you want to find this paper, it was published in JAMA Neurology, January 2018. It was reported in the New York Times, both the Sunday edition and the Science edition on Tuesday. And the evidence it's strong. I think it's strong enough to suggest people should do it. I need to, when I talk, especially when there are physicians in the room, it was done using a futility design. I'm not going to go into that. It's very complicated. The bottom line is we showed that 80 to 85% is worth studying in the future. And I will be writing a phase 3 clinical trial to do what is called an efficacy study. But these data are, in my view, quite compelling. So if you want to do something that slows down the rate at which your disease progresses, then the best evidence we have at the moment is high-intensity endurance exercise. There's a very nice review. Some of you are clearly exceptionally well informed about your disease. You take a lot of time to fully understand it, which I think is terrific. So there's a paper here just published in the Mayo Clinical Proceedings, published by a neurologist. I'm actually going to read it to you. You kind of know it, but it's a marvelous article because he's worked through all the literature very, very carefully. So the first bullet point we've heard lots about today. The next bullet point is a myriad of animal studies document direct, favorable effects of aerobic exercise on the brain. This includes liberation of neurotropic hormones and enhancement of a variety of neuroplastic mechanisms. In animal studies, the evidence is very strong that it's neuroprotective. I want to repeat, in animal studies, the evidence is very strong that exercise is neuroprotective. It does not yet exist in human studies, but I think that's a matter of time. So long-term exercise and fitness in healthy humans is associated with greater volumes of cerebral cortex. Hippocampus is very important. Hippocampus does a lot of work in terms of storing memories. And when hippocampus doesn't function well, your memory doesn't function well. Midlife exercise is associated with a significantly reduced later risk of Parkinson's disease. And then the conclusion, regular aerobic exercise tending to lead to fitness is the single strategy with compelling evidence for slowing Parkinson's disease progression. All patients with Parkinson's disease should be encouraged to engage in such regular exercise. So what I hope to have shown you is that working out 2 to 3 times a week with your heart rate elevated will help improve maximum oxygen uptake, your walking economy, many parameters of walking, and potentially reduce the rate at which the signs of Parkinson's disease increase. Those two alone are not going to solve the balance problem, okay? And you need specific exercise, probably to work with a therapist. So if you're balanced, freezing of gait, we heard a lot about that earlier on. And so to help improve balance, you need to be able to practice losing and regaining balance while taking steps. And you need to be able to continually move in a changing environment. Some people in the past, or some homes, for example, will try to remove all obstacles, not have people move about. They don't want somebody to fall. It's logical, but it's the worst thing you can do. It's the worst thing you can do. Tai Chi. Do we have anybody here who does Tai Chi? Well, you should talk to these people because I think Tai Chi is great. The evidence in the literature is compelling. And what you're trying to do, you've seen picture after picture of the classic Parkinson posture. Well, Tai Chi is trying to put you into extension. The mind is tranquil but alert. Consciousness commands the body. Body movements are slow, smooth, and well coordinated. Now there's improved balance in older and younger people. The literature is clear. A decreased fall risk. Now the next bullet point you need to be careful about. You had some wonderful presentations talking about orthostatic hypotension. So reducing blood pressure is not necessarily something one should be targeting, and you should be monitoring it with your physician. But improved posture is good, and any time we can reduce stress has to be good. So this is a paper published in New England Journal of Medicine in 2012, and this was a randomized phase 3 clinical trial. And it showed that tailored Tai Chi program reduces balance impairments and decreases falls more than gentle resistance training or stretching. I'll point out here that the resistance was very gentle. It's not the kind that I'm advocating, okay? But this was a very impressive study, and I think the evidence is strong that you should consider Tai Chi. Now, going to the gym, putting on a heart rate monitor, getting the heart pumping, it's not for everybody. It's not for everybody. But Tango is fun. Tango is seriously fun. And I have the pleasure of mentoring Dr. Hackney, the author here. She's published 15 to 20 papers on Tango. She was a professional dancer before she became a neuroscientist, and she has shown study after study that tango is beneficial. It improved balance more than traditional exercise. It improved mobility and quality of life. All the participants always wanted to have more programs. They're all very disappointed when it ends. So it's also something that one can do with a partner or somebody else. It is very social. That point was made earlier on. So I would absolutely suggest that you consider dance. So there's a theory called specificity of training, and the idea here is that if you want to get good at something, you have to practice it. If you want to get good at golf, you've got to practice golf. If you want to get good at balance, you've got to do balance activities. So you can either incorporate balance into progressive resistance and endurance activities, or do specific exercise or activities for balance. The reason I talk a lot about progressive resistance exercise and endurance exercise is because they are very easy to quantify, they are very easy to do science on, and come up with what would be called the dose. So one can control the number of times one exercises, how long one exercises, what the heart rate is, what the load on the muscle is. But I don't want you to think for a moment that I don't value the other forms of activity. I mean, I think they're all great. And at the end of the day, we all have a choice to make. I love aqua aerobics, and let me tell you why. So if you fall, the worst thing you're going to get is wet hair. And that doesn't seem to be as bad as a fractured hip or something like that. Cycling is terrific. I was out at dinner last night and we were discussing it. For some individuals, balance, although balance on a bike is quite different to balance when you're walking, but there are bicycles that one can have adapted. There are recumbent bikes. You can imagine a three-wheeler. One can do anything. So if you're the kind of person who just likes to be outside on a bike, make it happen. We've heard rock steady boxing mentioned. Okay, now this is good. Now this is good. So what I want you to do is, all of you, I just want you to wait for a second. And I want you to do that again, but I'll tell you when. Only think back to all of your LSVT training, and we want serious volume, okay? But just wait. There is Move Big, which is very good for one. Yoga, in all its kinds, is terrifically good. And then there are the therapies, physical therapy and occupational therapy. As we are all acutely aware, the problem here is how it is managed. You get maybe 18, maybe 16 visits a year. And what I tell people, what I tell people, sometimes you want to spread those visits out over a year. So instead of going 3 times a week for 6 weeks, you may want to go and see the person every month, or however you can spin or spread out your sessions so you have continuous support. So the therapies are very important. Okay, so as soon as we see the next slide, I want a bigger round of applause for it. So look, when I give this talk, I don't want you to think that I'm naive. I mean, I look around, not everybody comes in or at the age of Jimmy Choi and can do those activities. I know some of you are probably stage 3, maybe stage 4. You've got a large number of comorbidities, and you look at some of the things I presented and you think, I don't get, what's he talking about? I really do get that. That's why I have this slide. So you see here, there's a person, he'd be doing rock steady boxing sitting down probably, and you can do it. So my point here is that at whatever level of impairment you are, there are ways that a good therapist can help you do some form of activity. There are, for example, TheraBands. You don't need weights. You just have bands, and you can do work with your legs. You can do work with your arms. And what neurologists, some very famous neurologists, write about is empowerment. And this is what I learned, I knew it before, but it came really clear when I had lunch with the two gentlemen on the opening slide. You can either let the disease take over you, and it's easy to see how that happens, or you can come to terms with the disease. And every time I look at this slide, and I think some of these people, maybe mid-80s, every time I look at this slide, you know, what I think is empowerment, and people who said, I will get the better of the disease will not get the better of me. And so for those of you who are very much into a social environment, which I totally agree with, I think Rocksteady Boxing is great. There are many, many opportunities available in Chicago. Judging by the volume here, it is arguably the single most popular form of exercise, and I would encourage you all to continue doing it. And those of you who haven't yet started, I would get yourself a nice big pink pair of gloves and get punching. So we know the exercise prescription if we go through the literature very carefully. Do what you enjoy or are willing to do to maintain activity level. People have reviewed the literature very, very carefully, and there is no question that high activity correlates with improved quality of life. And at the end of the day, okay, you know, you've heard all the signs and symptoms discussed. For those of you who have the disease, you live with it on a daily basis. And the single most important measure for many people is just quality of life. What can be done to improve quality of life? And so, if you struggle with some of the other ideas, keep moving. Weight training twice a week is the best evidence for symptom improvement. Endurance training 2 to 3 times a week is the best evidence from studies on animals for neuroprotection. Balance training 1 to 2 a week for mind-body development, best evidence for postural control. I realize this adds up to quite a lot, and so that's why including the balance in the weight training or the endurance means you're only working out perhaps 4 times a week. I think one of the case studies, the person was exercising 4 times a week. Now, do listen to your body, do listen to your physician. To the best of my knowledge, there are no known detrimental side effects, okay? But, you know, Bill Bucklew and I did tell Jimmy Choi that, you know, maybe every once in a while he works out just a little bit too hard, and he kind of smiled at us. So do listen to your body. Don't go crazy. And for those of you who haven't exercised before, listen to your body. I haven't found a better pre-final slide than the following one. It is not that it was given by an Englishman, but if anybody has a better final slide for me one day, let me know. So Edward Stanley was 3 times Prime Minister, who simply said that those who think they have not time for bodily exercise will sooner or later have to find time for illness. So keep looking after yourself. For those of you who take part in science, I think there are several universities close by. We're sponsored here by Wayne State. I think I heard mention of Henry Ford Hospital. I think some of you may be coming from quite a way, perhaps Ann Arbor. For those of you who've taken part in studies, I personally want to thank you. One cannot move science forward without humans taking part. There is a big gulf between what you learn from animal studies, which is important, and what you learn from studying people who have the disease, because the goal always is the disease. And so for those of you who don't, so how many of you here have a dog but don't exercise? You have a dog but you don't exercise? No, well, the reason I ask is, so could you imagine having a dog and not ever taking the dog out for exercise? Thank you very much for your attention.
Thank you for that wonderful talk. I think we have time for a couple of questions, if anyone has any, for Dr. Corcos.
Yes, I will. I'm happy to take questions. What I'm going to do is I'm going to pan across. I won't go first because I won't get who was first. So I see a gentleman there and then the lady behind.
You mentioned that you should work out at eventually at 80 to 85% maximum heart rate. I'm on a machine. How in the heck do I know when I'm at 85%?
Well, that is a really good question. So the best way to do this, not the best way, well, first of all, you need to get a heart rate monitor. Now, you can do it in different ways. For those of you who have a watch, it has not a particularly good heart rate monitor on. It's not bad, but it's not great. What you need to do is to get a strap which goes around your chest. That's what we did in our study, and that will tell you what your heart rate is. Some devices, it's very hard to get to 80 to 85%. So unless one is an elite cyclist on a bicycle, to get to 80 to 85% is very hard. The way we do it in our study, we had people on a treadmill, and then you can either vary treadmill speed, or you can vary treadmill incline, or you can do both. So if you really want to do the same exercise program that we published in 2018, you go on a treadmill, you have your heart rate monitor, you wait till your heart is above about 80%, and hopefully it will do you the world of good. Yes, we had a lady back there. This lady and then that lady.
What about playing a musical instrument with music study, making music?
I'm sorry, could you repeat the question?
What do you think about, I have Parkinson's and I am a church organist. What do you think about making music, playing music, making music? What want?
I think music is terrific. So if any of you want to learn more, if any of you need any help in putting together music programs, I have a very good friend at Iowa State University, and she has a music program for Parkinson's disease. In fact, if I run into any of you, actually, if you can catch me over lunch, I will play you a video that I have on my iPhone of 12 people, and when you hear them sing, they don't sound Parkinsonian at all. And so there is the whole emotional side to it. And so the music, coupled with the singing, coupled with dancing, I think is wonderful. And I think the evidence is that it works. Yes?
Is swimming recommended at all?
Yes, now swimming is really, really recommended. I think swimming is terrific. And then there's also aqua aerobics as well. So one can spend some of one's time swimming, laps or whatever you're doing. And then the advantage of the aqua aerobics is that they have these devices whereby when you push down in the water, you're creating a resistance. And that is very good. And so I would absolutely encourage that. Yes, these two ladies and then the gentleman.
When you done the study, what maximum heart rate did you guys use? Was it 120, 150? Where does the 65 and then, or did you use individual person's heart rate?
Oh, this was always the study. So let me tell you, for those of you who are really interested, have the time, energy, resources, the best thing to do is many places give you what is called a stress test. So you go onto a treadmill or a bike, and they will tell you your maximum heart rate. You can use formulae, but the formulae are averages. They're good averages. But once you know your maximum heart rate, so if your maximum heart rate is 150, you take 80 to 85% of 150, and that's the heart rate that you exercise at. And that's a heart rate you can keep going for 30 minutes. And that's the heart rate which we have shown is likely to do you good. So this is all individualized. You can go, your trainer or a PT can give you a formula to calculate it. It's basically 220 minus age. But certainly when I use that formula, it's off by at least 10 beats for me. So I think the best way to do it. And what we're trying to do, at least what people like I am trying to do, we're trying to bring science to the forefront here. So when you take your medication, it is very, very well thought out. You just don't put your hand in and take a group of pills. It is regimented and thought through, and we heard people talking about diaries. Exercise needs to be thought through as well. Now, for those of you for whom it's just too much, go out and tango. But, yes.
I wanted to, I'm an exercise physiologist with PD, and I wanted to emphasize that all of these things, you know, you see Tai Chi and you see people moving in fantastic ways. All of them can be adapted with a good trainer so that you start where you are and work. The progression is the important part.
No, I'm very glad you said that, because I think it comes much better when one actually has the disease. So if you can tell people it can be adapted, I mean, I have seen it adapted, and I've seen people work out in wheelchairs. Absolutely.
We'll take one more question. Are you able to tell us about your trial, your upcoming trial? I'm over here.
Am I able to tell you about the upcoming trial? I am. So I'm writing it as we speak, so I'm always listening and trying to refine it. I hope to submit it to the NIH on October the 5th. And what we will be comparing is the 80 to 85% with the control group. We're still debating exactly what the control group will be. My current thinking, it will be probably 57.5% to 62.5%. That's a very technical answer. See, when you look at the data, the group which did 60 to 65% did slightly better. And so when you're comparing two groups and you need a statistical and a clinically important difference, if both of your groups are really quite good, then finding a difference is quite hard. So we want our control group to basically not do too well. Now that's from the point of view of science. I'm not talking about from the point of view of the individual. So, science is at a higher level than each and every individual. So we will randomly assign people to two groups. I have 30 sites interested. If there's anybody from an institution who has an exercise physiologist and a physician, movement disorders specialist, I can probably take one more site. We'll be testing, we think, 370 people across 30 sites to answer the question, is there a clear therapeutic benefit to high-intensity exercise?
All right, thank you. Thank you very much. Thank you, Dr. Corcos.